So we have heard something like runner's knee. So what is exactly a runner's knee?
If take an example of a guy who has been sedentary till 30-35, so they just put their watch, put their shoes and start running. So as age goes by, your muscle strength reduces, the muscle quality reduces. That is when people start getting knee pain. Is there what they want is just a strength training, or they want is to compete in a professional level? So after an age, it's gym is something to keep yourself healthy, fit, and also have a pain-free life without depending anyone. I am somebody who gives more importance to your overall body weight, your muscle strength, and your what exercises you are planning.
Yeah.
See, even if you wear a footwear worth 50,000 or 1 lakh, if you are a high BMI with lack of muscle strength, you start running for all of a sudden, you start getting knee pain.
Voices shaping the future of medicine. Stories, knowledge, experience. More for life.
Something interesting is happening these days. More people are joining gyms, running, and trying everything to stay active. But still, most of them end up complaining about knee pain. So, today, in this episode of Project Heal, we are going to understand the knee from a very practical point of view. And to help us with that today, we got Dr. Ankit. So, welcome, Dr. Ankit.
Thank you. Thank you for having me here.
So, doctor, to start with, let us understand the knee from a basic point of view. So, usually people think that knee is a single structure, but it's not that the case. So, can you tell us the anatomy of knee or how it is working?
So knee joint is a very complex joint. You can tell it's synovial joint. So knee has main thing is it is not just two bones, femur or the tibia. So there are many structures which give stability to the knee joint, like the ligaments, the meniscus, the cartilage, the bone. So all these structures work in dynamic movements or together. So if any of these structures gets affected, the knee can get affected. So the muscles around the knee joint, the ligaments, meniscus, everything works together. So it's a complex joint.
When we come to the exercise or running part, so we have heard something like runner's knee. So, what is exactly a runner's knee?
If there is take an example of a guy who has been sedentary till 30-35, so all of a sudden he decides he wants to prepare himself for a marathon, or maybe he want to start running. So all of a sudden what everybody does is they don't do adequate preparation. So they just put their watch, put their shoes and start running maybe 5 kilometers a day. So a couple of days, maybe second day, the knee takes it. By maybe when you start 30, when you do that at your 20s, you don't get knee pain. You never heard people in their 25s started running, they do whatever activities they want. They never tell that they have knee pain. So as age goes by, your muscle strength reduces. The muscle quality reduces. So there is always growth happening, and after a point of time, there is catabolism happening. So your muscle mass reduces, strength reduces, bone quality reduces. So that is a time when you need preparation. So people who don't prepare themselves, especially the muscles, or they don't give adequate rest or after a running episode for muscles to recover, that is when people start getting knee pain. So runner's knee can be simplified in that terms.
So, doctor, you just mentioned about runner's knee. So, do people actually need to stop running immediately when they experience a pain on their knees, or can they continue with modification on their exercise or running?
So I always tell my patients to be active. So you start getting pain doesn't mean you should not be active. So you get knee pain after episode of running, that doesn't mean you just need to stop running. So I would suggest them to do some activities which involves less axial loading, maybe swimming, cycling, or give some muscles training, strength training. So what happens is you should not run like in a week. You take an example. If you start running every day 5 kilometers, by third day you will be pushing. It can be different for everybody. Everybody reacts or responds differently. You can't tell a heart specific rule that you will get knee pain in the third day. So somebody gets a knee pain after running episode. So it can be two types. Some people get it initially when they start running, but after getting warmed up for some time, they feel the pain is gone. And there is second category of people who starts getting pain maybe end of the run, or maybe after like 5 kilometers they start getting pain. So end of the day, these two issues is causing pain. So it can be because of some damage to the cartilage. So in those cases, what we do is, what happens, we have to do an examination, not maybe the first episode of pain after maybe the first run or a second run, but if this cycle is repeating itself. So what normally people do is, they get pain, they stop running, they see 1 week, I think they feel better, so they start running again. Again, this cycle repeats. Only maybe the second type or the third cycle, they think they need to see a doctor. So in these problems, if they develop any swelling in the knee or there is some effusion in the knee, that means there is significant damage happened to the knee. So in those cases, they should stop running for a couple of days, evaluate it, what was the reason for them to get pain. Is it because of excessive running without adequate rest or recovery, or is it because of some other previous knee problems or an injury which they had neglected, which has shown itself because of the stress which happened to the knee. So a clinical evaluation needs all those factors to be understood. Only then we can adequately understand what is the cause for that pain and then treat accordingly. So imagine if that guy didn't see a doctor. So what I would suggest is, maybe take a break from running, start swimming, something which involves less axial loading. So swimming, you don't put much load in your knee. So that would be my advice. But always the pain factor has to be evaluated and should find a diagnosis. What was the root cause of pain? Than pushing yourself.
Okay. So when we talk about diagnosis, what are the clinical evaluations or tests you used to do?
So everything starts with the history. So what made the patient come to me in the first place? So as already I mentioned, these are the problems. Some people experience from the first couple of steps of running and then it goes off. Then they feel all warmed up and they don't have any pain. Maybe the second group experiences pain after couple of kilometers, maybe 10-15 minutes, and that pain may be not that significant enough for them to stop the run. So, but initial days, but maybe once they keep pushing it, it will reach a level where the pain makes them stop the run. So all those factors along with examination. So if there was an effusion in the knee, so is the pain affecting their day-to-day activities? So what happens is, these pain doesn't affect their day-to-day activities. So all these people can be able to walk normally, climb steps, climb down stairs, normal office work, sedentary, sitting, desk job, everything is going fine. Only thing, the running part is getting affected. So that is also points to many clinical findings. And then finally comes to the examination part. Also, whether this pain is affecting their day-to-day activities, I mentioned. Whether night when they sleep, is this pain coming up?
Okay.
So combining all these things, we come to one clinical diagnosis and then we confirm it with clinical examination. So anytime you have to examine the knee, see what is happening in the knee, where is the pain factor, so if the movement is adequate, if there is any ligament laxity, and then along with your investigations and MRI gives to a perfect 100% clinical diagnosis, and then from there we plan what can be the best treatment for that patient.
Okay, doctor. So one thing I was curious about, you mentioned about the pain in the night. So is there any scientific reason for the pain in night?
So what happens is, meniscus tear or pain from some cartilage damage, people get pain more in the night. Maybe end of the day, moving the knee, so knee gets loaded from morning to evening, and then night time, rest time gets pain. And also when you keep moving the knee, so when I sleep at night, if my knee rubs over the other knee, so it's like most of like I putting pressure on the point.
Okay.
So when one knee falls on the other, invariably the pressure of one knee is touching the other knee. It's more or like me pressing that point of pain. So that also can cause pain.
Okay,
So night pain is kind of a significant finding in examination. So if somebody experiences night pain, that is something which you should see a doctor for.
Okay, so even the sleeping position
Yeah.
matters for the knee pain when it comes to it. Okay, doctor. So one more thing, people usually do squatting and other exercises. So is it really good for the knee or is it impacting badly?
So end of the day, the question is whether squatting is good for the knee or what exactly is the patient wants. See, if you want to start a gym, what is that you want from going to the gym? Not just to show people that you can squat or bench press.
Usually,
Yeah.
actually, that's why people
So
go
that
there.
is what happens. So first thing is somebody should understand what they are expecting from that level of activity. Is there what they want is just a strength training, or they want is to compete in a professional level? So after an age, it's gym is something to keep yourself healthy, fit, and also have a pain-free life without depending anyone. Maybe yeah, long-term goals. So it's not like 35 you all of a sudden decide to start squatting and be start professional level. Yeah, that is different, but people who do that is very less. So identifying what exactly is the reason you go to the gym, and that in turn is making you understand whether you need to squat or not. So take an example of a 35-year-old. Maybe he is obese, BMI more than 30. So he starts decided to go to the gym. So his aim may be taken to lose weight, maybe lose weight. So if he squats all of a sudden in the first day in the gym with this maybe around 100 kg, that is going to put too much pressure in his knee. So it is not about whether squatting is good or bad. It's about doing the right thing at the right time of your journey to weight loss or to adequate strength. So yeah, squat puts too much pressure in your knee, but that doesn't mean you shouldn't squat. So you should start with simple exercises which involves getting your muscles strength, and then maybe exercises like squats which put 3 times the stress in your knee joint. So yeah, that is what I would suggest. Take it slow, understand what really you reason why you came into fitness, and then long-term goals would benefit. Then starting squatting immediately, you start getting knee pain, and then you stop everything, and this cycle keeps repeating.
When an obese person do squat, it affects them. But usually, when a person is obese, does it affect the knee strength, or putting a lot of weight can affect knee?
So obesity is can be types. There can be a guy who is overweight, but he is adequately built. You can see people who are hefty built, so their body weight will be high. So
Okay.
body mass index, yeah,
It is what
yeah.
matters.
So
Yeah.
what happens is if obese guy who has a high body mass index, he wants to squat. So maybe I would start not 15 3 sets 15 15 15 all of a sudden. So for him, I would suggest diet, swimming, cycling, exercises which involves less axial loading, and exercises which develop the quadriceps. Maybe other than squatting, there are different exercises you can do to develop quads. And once he starts developing adequate strength, and then maybe he can do squats also, because squats put too much body pressure in your knee joint. So he should have that core strength and also the quadriceps strength to support that weight. So squatting, it's if he wants to squat, he should prepare himself to that level of muscle strength and core strength so that his knee joint can take the weight of the squat. And also maybe body weight squats for a long time, and then once he develops good strength, maybe he can start with weight. There is no contraindication. No, there is no hard fast rule that yeah, if you are overweight, you can't squat. If you want to squat, prepare yourself for doing that, and then maybe once your body, muscles, everything is prepared, yeah, then you can start. 1 kg you put on weight, there is 5% stress happening to your knee joint. So you lose 1 kg, you reduce 5% stress. So that is basic one calculation. So if you are overweight, your knee is suffering because
Okay.
your body mass index is high.
Yeah.
So if you want your knee to be fine and you have overweight, you should develop adequate quadriceps strength to support that weight. Or you lose weight, make your BMI in the normal range, and also keep developing your quadriceps.
Okay, doctor. So when we consider the knee structure, there is meniscus tear. So what is there in meniscus tear that causes pain actually?
So meniscus is one of the best structures God has given. So you have two meniscus,
Mm-hmm.
one inner side, one in the outer side.
Yeah.
So basically, it is like a shock absorber to the knee joint.
Okay.
So what happens is, so you have a chair. If you have a wooden chair, you put it in the tiles. You have a washer.
Yeah.
So it gives so that the wood doesn't rub the tile and you don't have any scratches in the happening. So meniscus is kind of like a shock absorber between your thigh bone and the tibia, leg bone. So meniscus injuries can happen in time. So imagine osteoarthritis.
Yeah.
So everybody tells in age your knee gets degenerated, worn off. So whether so meniscus is one of the first structures. What happens? So repeated axial loading, the shock absorber, the quality of the meniscus gets reduced. So what happens? Even the meniscus is not able to withstand the shock. So it gets reduced in size. That uh, stress, how much it can take throughout your life, it gets quality gets reduced. So there can be two types of tear. So it can be age related tear, or it can be something which happened because of an injury.
Okay.
So yeah, so what normally meniscus tear injury, it should be a high velocity injury, or maybe something a sports injury or twisting injury. Maybe you slip and fall, you had a sudden flexion of the knee. So meniscus is one structure which causes pain, especially if it's torn. Unlike ACL, which doesn't give you a pain.
So, sir, you just stopped mentioning by ACL. So, we have heard a lot of sportsmen telling about ACL. So, what exactly is ACL?
So ACL is a ligament inside the knee, anterior cruciate ligament. So it gives stability to the knee, especially when you are decelerating or something which gives stability. So if an ACL is not there, what happens is when you are stopping yourself, the body force, the knee slips front because there is no structure inside the knee which stops the deceleration. So what happens is the knee gives away. That is when you feel your knee is unstable. So everybody has an ACL. What happens is it gets torn. Most of the times, football, basketball, some pivoting injuries, sudden turn, or maybe non-contact contact injuries. So that is what happens when your ACL is torn.
Okay, doctor. So, when ACL is happened, does it affect the sportsman performance later on, or can he go play the game again freely?
So without an ACL, you won't be able to play that level of sports, because sports involve sudden acceleration, sudden deceleration, pivoting. So all those sudden fast movements, your knee will give away. So he won't be able to stop. If he is going in a speed and he wants to stop the ball and turn around and give a pass. Once he tries to stop, he'll just fall down because his knee is not stable. So that decelerating force can't be stopped because of the knee gives away. So that is what happens. Repeated injuries happen. So that can cause injuries to other structures like a meniscus or a cartilage, and that gives him pain. ACL never gives you pain. Isolated ACL tear in your knee, all these neglect, or people starts neglecting that ACL tear. So what happens is you see an ACL tear, patient is like, okay, I'll stop playing. That will be the first mentality. So because he'll be somebody works in IT, or maybe who does a desk job. You don't need an ACL to ACL for a desk job. So, but every time he does pivoting or fast movement, or maybe he starts running, maybe stops himself, his knee gives away. So it happens maybe once in 3 months, then it happens once in 2 months, then it happens regularly. Finally, it will cause meniscal tear. That is when he will experience pain, and that is the time he would come see a doctor. So one injury, one surgery, he has made in two injuries, ACL plus a meniscus, maybe associated cartilage also, because he has been neglecting his knee. So one surgery which can protect his knee made into three surgery. I mean one surgery,
Yeah.
but three structures has to be addressed. So always your knee gets spoiled if you neglect an ACL.
Okay. So, you should be careful when ACL happens.
ACL is torn, you should have a ACL
So,
reconstruction.
how can we actually understand if it is ACL when we have this?
So anytime your knee feels unstable or your knee feels weak, you feel when you're climbing down step, or maybe you turn fast, your knee is giving away, or knee slips, that is when you understand you have an ACL tear. So even if the MRA shows partial tear, physiotherapists tell you, yeah, this can be done with physio. I'm not it can, okay, if he is doing all these exercises, but still some things he feel, still end of the day, after rehab everything, he still feels his knee is unstable. If he doesn't have that confidence to run, if he feels his knee is giving away, that means ACL is torn and whatever rehab he is doing is not working. So that is the time somebody or anybody should realize that he should undergo an ACL reconstruction than wasting time. See, it's about wasting your productive time.
Yeah.
See, 6 months, 1 year, how long you stop playing? You stopped. Somebody who plays football once a week, 2 weeks, he stopped playing because of this, and he's lost 6 months, maybe in his 30s, 25s, and that is the time you don't get back. And then
Yeah.
5 years later, you decide you want to do ACL surgery. What happened to the 5 years of not playing? So always understand what you're losing and what you're gaining from it. I don't think people lose most of their valuable time of, see you some, I don't think everybody starts playing at 50, 55.
Yeah.
I mean, yeah, there are people, their goals are different. So if you decide, if you are somebody in your 20s and 30s who don't have an ACL, I always tell them, see, it's not about not playing, it's about losing that time of the year and then finally regret it at 50 and then do an ACL. I don't think there is a point in it.
Also end up in doing multiple
Yeah,
surgeries as
yeah.
well. Okay, doctor. So when a person comes to you with a knee pain or such knee slipping away problem, how do you identify? What are the clinical evaluations used for confirming it is ACL?
So first and foremost is always what patient tells me. So what he tells is mostly his knee is unstable. So that is pointing into an ACL. And then if he has pain, so pain can be not because of an ACL. So pain can be because of a neglected ACL, repeated instability. That is causing him pain, maybe a meniscal tear. Then third thing will be if there is a swelling in your knee. So swelling points to, for me it can be meniscus or it can be a cartilage injury, and night pain. So all these factors is what clinically he tells me, and then comes to examination where you see the knee joint. So
Yeah.
first and foremost is the alignment. So you ask the patient to stand, expose. You have to see the whole knee joint. Ideally, a patient should be above the thigh, so that you see whether the knee is straight, knee is bent inwards or outwards, and then examination. You have different tests to see the pain, instability, and then finally comes investigations where you do a X-ray and a MRI scan, and then you come to a definitive diagnosis of ACL and what are the other associated injuries which happened in your knee joint, and then you address it accordingly.
Okay, doctor. So now when we come to the surgery part, what exactly is done in the surgery part?
So surgery part we do exactly what the diagnosis is. So if patient
Okay.
has an ACL plus a meniscal tear, then we do the ACL reconstruction and then we repair the meniscus. So every time we always try to repair the meniscus, but there are circumstances where the patient itself has neglected his knee and the tear. There can be different types of tear. So there is no hard fast textbook rule. This tear, this tear, this tear. Every knee behaves differently and every injury is different.
Yeah.
And every patient is not in the same height, weight, BMI, and even the muscle strength. And there is inbuilt hyperlaxity. Some
Yeah.
people are more flexible, some people are not that flexible.
Yeah.
So there are like many things. So it's always, the time is gone where one diagnosis, one surgery. So it should be always patient centered surgery. So patient like personalized surgery, like how you get the menu, you order whatever you want. So based on that patient what he wants. So my surgery is planned on what patient's expectation is. So if he wants to go back to playing football, he wants to go back to being pain free, he wants his knee to be pain free for a long term. So there are many factors which decide.
Yeah.
So I can tell maybe a 35-year-old patient who comes for knee pain, so already he has been neglected knee injuries. So maybe around 40, 45 you tell. So he wants his pain to be gone. He wants his knee to be stable. He wants his knee to be preserved.
Yeah.
So in those cases, just an ACL surgery won't help him. So as I told you, alignment matters. What is the status of the cartilage presently? So there are like many factors which comes into play, and then we can tell him this surgery gives you all these required expectations. Maybe I can match to that expectations or functional outcome of that patient. So yeah, basically ACL, meniscus, cartilage, and also the alignment. Based on patient to patient, it changes.
So, doctor, I've heard that certain footwears we use in running or doing anything, it affects our knee health. Is it a myth or is it true?
So footwear is important, but I am somebody who gives more importance to your overall body weight, your muscle strength, and your what exercises you are planning.
Yeah.
See, even if you wear a footwear worth 50,000 or 1 lakh, if you are a high BMI with lack of muscle strength, you start running for all of a sudden, you start getting knee pain.
Okay.
So it's not about changing your footwear. I feel it's more of like building yourself to what exactly your goal should be. So same guy who maybe a lean guy who doesn't wear a footwear, he runs barefoot, he shouldn't get knee pain.
Okay.
He won't be getting knee pain. So end of the day, it's not about what expensive footwear you buy or what brand footwear you use. End of the day, you should body should be strong enough or muscle strength should be adequate enough to do the activity, and you should choose activities accordingly so that you adapt your body to that level of fitness and then you start doing the activity. Yeah, good footwear is important with heart support. So I'm not a fan of this footwear is good, this footwear is bad. It's my personal opinion.
Can we know something interesting from your experience, some cases maybe?
One patient uh, who came to me in his 50s. So he's an auto driver. So he had an ACL injury at around 18 years or 19 years. He was
That long?
yeah. So he was playing perfectly. I mean, he was very good in football. So he used to play in good level. But maybe after an injury, circumstances, the amount surgery that time, so he was not able to afford that ACL. So what he did is, and circumstances also. So maybe he had to stop playing. He had to make a livelihood. So he started working. So that is when. But see, he was fit. He kept going. So 50, he came with to me for knee pain. So ACL injury at 20 and 30 years later, he came for knee pain.
Yeah.
But that was after an injury because he had an instability that caused a meniscal tear and he came to me with knee pain.
Okay.
So that is one of the case where a neglected ACL, so everybody doesn't reach 50 just because he was working hard, he had a good BMI and an adequate, very good muscle strength to be precise. He was somebody who works every day. So that is one interesting case, not interesting, maybe some guy who has sacrificed his career because he was not affordable to do an ACL and his circumstances made him to shift to, I think he was driving auto. Yeah. So that is maybe a interesting, not interesting, maybe some case which has stuck to my mind.
Yeah, maybe like a perfect example why you shouldn't neglect
Yeah.
ACL tear.
Yeah,
Okay.
maybe. Yeah.
So, doctor, when patients usually experience these kind of knee pains, they usually try home remedies at home. As you told, they might delay their surgery or consulting a doctor. So, does these home remedies actually work?
So it depends on what are these home remedies. So
Okay.
yeah, home remedies is it's a very broad terminology.
Yeah.
So I am not sure what exactly you mean by home remedies and what remedies are the patient using.
Maybe oil massage or heat applying.
So all those things doesn't address the root cause. So
Okay.
if there is a pain, there should be some cause for
Internal
the
thing,
pain.
yeah.
So if I know the cause, yeah. If maybe it's just a muscle strain, yeah. Some massage, maybe some ice pack, heat can help. Maybe pain after exerting, all of a sudden he gets pain. Maybe some ointment, oil application can help pain. So maybe you can. I'm not against any line of treatment unless it brings harm to you. So yeah, if it remedifies your situation, go for it. But after doing it and trying it, still it doesn't work, then maybe I feel you should start realizing that line of treatment is not working, and still the pain factor or whatever problem you are having is still persisting. So maybe that is the time you should stop trying home remedies and consult a doctor.
One condition that many runners told they have is contramalysia patella. So, what is that exactly, and how is it actually different from runner's knee?
So what happens is your patella is something which is in the center of the bone. So quadriceps muscle comes and inserts to your patella.
Okay.
So quadriceps muscle is just not one muscle. It is a group of muscles. So it has something in the inner side, central, inside, lateral side. So all these muscles, when you work out, you don't work out the same way. So some muscles gets activated more, some muscle gets activated less. So what happens when there are four muscles coming to your patella and some muscles are overacting? So these overacting muscles tend to pull your patella on that direction.
Okay.
Whereas the weak muscles, since it's weak, that muscle, that part of the patella may get overstrained. So it not happens in runners per se. You can have some people who experience pain while climbing stairs,
Yeah.
early 30s or 25, or some people who experience pain while sitting for a long time. Maybe watching a movie, they feel their knees paining, and they slowly extend their knee, and the knee pain is relieved. Most of the times, only in the sitting position or when the knees bend, they experience pain, or maybe climbing stairs. But it gets relieved with straightening the knee. So those cases, the patella it's getting loaded. So only when these cases have associated swelling. So you keep getting this pain and you start getting swelling in your knee along with that pain. That is when you should think about something more is happening than just a overloading of the patella. So repeated pain or overloading of the patella can cause damage to the cartilage. So that in turn can cause swelling or effusion in the knee joint. So that is when you should see a doctor for further workup. So it can happen because of your core or adequate quadriceps strength, hip core mobility. So there are many factors which gives stability to the knee joint. So imagine a guy who has been squatting. If his core or ankle is not strong enough, he may put more stress in his knee joint or the knee may get pushed inside. So it's not just the knee you should work on. So it can be a problem from the ankle or the hip or from the core. So all these factors can cause pain in the patella. And these are only the dynamic movements. So there are static factors. That is some factors like your anatomy. How is the bone? So if your bone is rotated, is there is some difference in your version, something more complex, less likely. I mean, it's not that common compared to all these dynamic structures. So unless most of the times strengthening and physio rehab exercises can correct most of the problems, unless it is persisting. So a patient who has a knee pain has to be evaluated completely, his anatomy, bony structures, static muscles, ligaments, all those structures, so that we know, okay, this can be treated with rehab or adequate strengthening of the muscles. Whereas these structures, something which requires a surgical correction. So it's a complex thing, but understanding the root cause is always important.
Okay, doctor. So by evaluation only, we can say that does that patient need physio or other surgical
Yeah,
methods?
exactly.
Okay. So what kind of treatment other than physio or surgery, when it comes to surgery too, what kind of surgery is done for these people?
So now it's kind of like a la carte menu. So patella, there are like 1,000 surgeries
Okay.
described. So always what is best for the patient is what matters. So
Okay.
if one patient, a surgery can be just rehab. Maybe the same problem, another patient, it was just a ligament reconstruction. Whereas same problem, another patient was a bony correction with a ligament reconstruction. So there are complex surgeries described.
Okay.
So it depends on patient to patient. It's you can't hardly tell this problem only this surgery is needed. So there are many problems which has to be addressed. So only once you understand the total altogether. So if I tell there are like one patient who have had a patellar pain, so he had undergone 5 different issues were addressed in one surgery.
Okay.
So that complex it can be, whereas just muscle strengthening or one ligament reconstruction can be also done. So patient to patient it varies.
So does bone density has an impact on the knee?
As your age goes get older, your bone quality or the density reduces.
Okay.
So there is stress needed for bone formation. So that stress should be not more whether you put risk for fracture, but it should be adequate enough to withstand the body weight, not to harm your knee joint, and also a little bit stress to the bone so that bone remodeling occurs. So it's you can't hard fast rule is not there. It's very difficult to tell exactly to tell like a 50-year-old who has osteoporosis, who had a history of fracture. So let's say fragility fractures. So fracture which happens because of osteoporosis. So if patient has had a distal radius fracture or maybe a hip fracture because of trivial trauma, and yeah, she is kind of osteoporotic, so her bone quality is different. So what amount of stress she can take is different compared to maybe a 40-year-old who didn't have any fractures, a female. So her quality is different.
Okay.
So everybody needs some stress for newborn formation. So if that stress is more, maybe she put too much stress in a knee joint, so that bone can have intratrabecular fractures, or maybe you can call it bone edema. Maybe a small impact. See, a force of so much Newton causes fracture,
Okay.
whereas force not causing fracture doesn't mean the force was not there. The force was generated, so the force has to be transmitted from to inside a structure. It didn't fracture the bone, doesn't mean it's dissipated. So the force is gone somewhere. So that in turn causes pain. So that you can tell, I feel one of the most highest research happening is bone edema.
Oh.
So where you have some changes in the bone, so bone quality reduces, maybe intratrabecular fractures. So that causes knee pain. So it's something which is doing a lot of research is happening right now.
Okay, doctor. So now that we understood about the surgery methods and all, are there any risk factors after the surgery?
So every surgery has its risk.
Okay.
So any surgery, there can be infections, there can be fractures happening. So surgery to surgery, every surgery there is, I mean, every surgeon wish he doesn't have any complications during his surgery,
Yeah.
because everybody wants a surgery to go perfectly.
Yeah.
But yes, perfect surgery means you prepare for the worst complication.
Yeah.
Unless you are not prepared for anything, then something which you see, everything, some things you can't be unexpected.
Yeah.
So always every surgery, any surgeon goes, he prepares for the everything, making sure that nothing happens.
Yeah.
So for me, doing a good surgery means avoiding complications. So every step has to be planned meticulously so that you don't have a complication. But sometimes you may get an infection. Sometimes you may get a re-tear of the ACL. So it can be, infection can be because of many risk factors. So all risk factors has to be addressed or taken care, noted what was the reason for that risk factor. So a diabetic patient with high BMI, uncontrolled sugar levels, he is always at a high risk of having an infection. So proper counseling and patient education is more important in such cases. And also, yeah, a re-tear of an ACL, it can be because of many factors. So I feel based on when he had a re-tear, whether it was within 3 weeks or maybe 3 months of surgery, or whether it happened after 3 months of surgery, whether it happened because of a re-injury, or it happened because of any other factors. So there are like many variables you have to look into. Again, identifying what was the reason for that re-tear is important. So it doesn't mean patient had a ACL, surgery was done, again he tore his ACL. So anybody can do an ACL, but doing an ACL is not the important thing. It's about identifying what was the reason why that specific patient tore his ACL after an ACL surgery is important. And then doing an ACL, understanding that problem and only addressing it, that will give him a stable ACL which is more stable, which can be there for him lifelong.
So, doctor, for the people who wants to stay active without damaging their knees, what will be your piece of advice for them?
So my piece of advice for them would be maintain adequate body weight.
Yeah.
So exercises regularly, strengthening. Always don't push your limits to level of workout. I mean, you can push your limits, but with adequate recovery time.
Okay.
So half the people here have job, they do workout, then they have to get back to their work. They have food, food style, everything is different. So you can't compare yourself with some Instagram uh, fitness trainer, because his job is fitness. So
Yeah.
what level of fitness he does, you can't recreate. It's difficult to recreate in your life, because you wake up, you work out, You have to go to office, you come back, you have to travel, you have sleep get affected, you may have family, you may have kids at home. So all these factors come into play. So always plan your workout in a way that you have adequate recovery. You keep going, keep long term goals would be my advice. So one day if you do strength training, I would suggest one day you do cycling, one day you do swimming, maybe running, you do one day 5 kilometers. Don't push yourself to 10 kilometers next day, because already you have pushed your muscles and knee joint. So maybe that is the day when you start getting a pain in your knee. So maybe that after a 5, maybe give adequate rest. So yeah, you don't want to sit at home, I want to do something. Do some strength training next day, maybe just yoga, maybe stretching exercises, swimming. So always have a mixed workout than sticking to only one workout routine. And pushing that limit should be always when you have adequate recovery. So if you push yourself to the limit, make sure that you have adequate recovery also, so that you get back to the same level of activity. I think that would be my advice.
Yes, doctor, everything makes so much more sense now. So instead of going behind trends, you should know your body and you should plan your workout, everything accordingly.
Yeah, listen to your body. If body gives you pain, there is some reason for it. Some pain is good, doesn't mean all pains are the same. Okay,
Yeah.
there is some pain you get after a workout or a muscle soreness, but there are some pain. Obviously, a person who goes to the gym has the ability to differentiate this. He or she would know that pain, how what he feels is different. It's not the same pain he has experienced before. So any pain you experience after you're 30, maybe depending patient to patient.
So,
Now if you're sedentary, yeah.
yeah, so 20s you are safe is what you're saying.
Now I don't know, because see, there was time people used to play a lot in 10 to 20. Now people are more into kids are more into games, indoor games, so video games. So it's difficult to comment about their bone health or a muscle strength compared to the generation previous, because there was a time when every day people used to go play. So I mean, everybody is different. I'm not telling that what people like they do. So some people like playing video games, indoor games, some people love outdoor games. So age now taking into criteria, 20 should be one of the good age, but patient to patient it can vary.
Yeah.
So I don't feel the health status of a 20-year-old, 22-year-old who has been sedentary, who plays video games, who has not been to outdoor games, who has not pushed his body to various level of activities, maybe he is not safe. So his body will eventually tell him, give him signs whether he is safe or not. Any pain he experiences, maybe that has to be overlooked.
Yes, doctor, understood. So thank you so much for joining us today.
Thank you.
You.
Voices shaping the future of medicine. Stories, knowledge, experience. More for life.